Welcome back to the History of Nursing. My name's Francis and these are my cats and co-presenters Loki and Ophelia. As you can see, we've upgraded our time machine to mirror the major upgrade in nursing that happened after Florence Nightingale came onto the scene. There's a plethora of Florence Nightingale videos out there, and I'll put some links in the description for those who want to study her further. For the rest, here's a very condensed version of her life. Born in 1820, Florence Nightingale was an incredibly smart and hard-working woman. In 1845, she decided to become a nurse, which, at the time, as described in the last video, was not a popular choice, and I mean not a popular choice. The decision caused outrage in the family. After training and much persuasion, she went to serve as a nurse in the Crimean War. Now, the media rhetoric of the time wrote more about the angelic persona, as in the lady with the lamp. In reality, she was more of an excellent statistician, and when she studied the death rates of the military hospital, she found that more soldiers died from infection than from the injuries themselves. She assembled 34 nurses who cleaned the deathly hospital within an inch of its life, no pun intended, and worked constantly herself tending to the injured soldiers. Her work managed to reduce deaths in the hospital by 2/3. In 1860, she started the Nightingale School of Nursing in St Thomas's Hospital and changed how the public viewed nurses forevermore. Now, recently certain letters have been published that are controversial to Nightingale's image, but they are not relevant to this video, and if you want to research those, you can. Nightingale was not the only nurse that changed what nurses did and how they are viewed. Mary Seacole also played a vital role in the nursing workforce. Born in Jamaica, her mother was Jamaican, but her father was Scottish, so she was freed from being forced to work as a slave. She was praised for her work in successfully caring and treating those who had cholera in Kingston, as well as in Panama. She also nursed in the Crimean War. She was closer to the front line than Nightingale. It goes without saying why Nightingale was remembered more than Mary. However, her contribution is vital because our current nursing workforce is the most diverse out there, and that makes it amazing. It must be also noted that Mary was not accepted to nurse in the Crimea. She had to fund her own trip to the front line, and when she returned to the UK, she was bankrupt. However, a festival was held in her name to raise funds, and multiple contributions came from multiple countries. She did fall into obscurity after her death, but in the late 2000s she was discovered again, and now has a place in NMC history. And quite right too. So now we have a completely different picture post-1860. Nursing is not just a last resort profession for the desolate. It now requires training, saves lives, and also it's not just for the white and privileged. From now onward, we will see a completely different picture to how nurses work and operate alongside how society views them. From 1860, when the first nursing school was established, to 1960, healthcare as we know it completely changed. In the brief period of 100 years, Alexander Fleming discovered penicillin, surgery became a lot cleaner and safe, insulin was used to treat diabetes, the first professional register of nurses came into act, the structure of DNA was discovered, the NHS was formed, nurses are now state-enrolled, and the first blood bank was set up. Alongside that, social change moved at a light speed, especially with the rights of women becoming more and more equal, but not quite equal to men. This was due to first-wave feminism, starting with the hard work of the suffragettes. If you compared a hospital from 1960 to a hospital from 1859, the difference would be staggering. Hospitals in the 60s were clean. The staff were all trained and the treatment was available to all, with national insurance being commonplace. Diabetes and pneumonia were no longer death sentences. There is a wonderful video about how insulin changed the lives of millions that I'll put a link to in the description of this video. Even though high-fat diets and smoking were decades away from being linked to bad health, the general health of the population in the United Kingdom was steadily improving. Hospital ward hierarchies were now normal, with a sister in charge of nurses who had their own patients. The image of the nurse was also steadily improving. They were not seen as the lowest of society, and that was largely due to how nurses were trained, the uniforms they wore, and the professional values that were instilled in them. That being said, the patriarchy was still rampant, and that had a tremendous effect on nursing professional identity. Even though so much progress had been made by the 1960s, women's rights still had a long way to go. This greatly affected the image of nursing. nurses in the early 20th century were pictured as virtuous, angelic, and also white. The image of angelic nurses was further propagated in both world wars, with posters recruiting military nurses showing angel-like figures in red capes. Whilst nursing is a noble profession, calling them angels robs them of having feelings or negative emotions. You also don't worry about the pay of angels. The battle axe nurse stereotype was brought to life in the film One Flew Over the Cuckoo's Nest with Nurse Ratched, never smiling and always quick to scold and punish someone. The sexy nurse, which was created from Seaside Postcards, the Carry On films, and awful general sexism, is one of the most damaging stereotypes a nurse has to bear. Not only does it demean the profession, but also explains away the all too common instances of nurses from all genders being harassed by patients. If you think about it for more than a couple of seconds, the act of physically caring for someone in a skilled way and a Mills and Boon novel are complete paradoxes when placed next to each other. One can't talk about the history of nursing without addressing its most darkest hours. Whilst the majority of nurses use their skills and ability to do good in the world, the profession attracts a small number of people who abuse that inherited trust of patients and commit unspeakable acts of violence. Every couple of decades, there is a case of a nurse murdering innocent people who were placed in their care. A study conducted a review of 90 separate criminal prosecutions of healthcare workers and found that 86% of those who were prosecuted were nurses. Now, one needs to be critical of those numbers because statistics are never truly absolute. However, the role of the nurse tends to have more time at the bedside with the patient, and maybe that aspect was taken advantage of to commit acts of violence. Not only do the friends and families of the victims suffer physical and psychological damage that will take a lifetime to heal, but fellow nurses who only do good feel outraged and cheated by these lone individuals who undo in a second all the hard work the profession has done to gain the trust of the public. The most notorious was Nurse Beverly Allett, who murdered 4 children and injured 9 others in a ward in Grantham Hospital. The two main reasons why it took such a long time to convict her was that firstly, Allett repeatedly lied protesting her innocence, and secondly, the idea that a nurse would attempt and succeed in murdering a child was so appalling and unbelievable that it was almost never thought of. Even though these atrocities were not a representation of nurses as a whole, they are important and should not be forgotten lest it happen again. These monsters in plain sight irreparably damage the professional identity of nursing. I would not recommend seeing it, but if you type in the words nurse and film into YouTube, you will come across a film called Nurse that scored 27% on Metacritic. It is a film about a serial killer nurse. Imagine if you are a vet and you go to see a film titled Veterinarian, and it's about someone who murders thousands of animals and it's glorified. You'd be mad, wouldn't you? Whilst greater safety measures came as a result of Allett's crimes, it will have a lasting impact on how the public view nurses. Apart from Harold Shipman, the Francis Report was one of the most shameful periods in the history of UK healthcare. To summarise, irresponsible decision-making from hospital management, cost-cutting at a dangerous level to reach financial targets, and a lack of support for whistleblowing culminated in the culture of neglect at Mid Staffordshire Hospital. Patients were found to be drinking water from vases as they were dehydrated, and upon further investigation, patients had died from reversible causes. The report showed that the hospital had a level of indifference to the amount of neglect shown by nurses and doctors. How nurses were trained changed as a result of that report. My nursing curriculum was more philosophy-based and less in the sciences as I started my training a couple of years after that report was published. Because this is still recent history and many people watching this video will have a personal connection to it, I will be brief. The pandemic happened and it was bad. However, we learnt a lot from the experience. One of the positives that came out was that the global sharing of research led to a vaccine being developed at the rate of knots. Let's step away from the darkness and join Loki and Ophelia in the present and the future of nursing. Advanced clinical practitioners, advanced surgical practitioners, advanced critical care practitioners, these are all new roles developed in response to the evolution of nursing practice. The age of the internet has created a constant battle between healthcare conspiracy nuts and licensed practitioners. The strikes will change the face of nursing. To exactly what, I am unsure. However, some things remain the same from the times of the Roman Empire till now. We care. We're good at caring, and we'll get better and better as we continue. That ends the series on the history of nursing. Thanks to Loki and Ophelia for their support and help. Please like and subscribe, and until next time, it's bye from Loki, bye from Ophelia, and bye from me, the eccentric nurse cat dad.